Alzheimer's disease is an irreparable, ongoing brain disorder that gradually destroys memory and thinking abilities and the capability to perform the easiest tasks. Alzheimer's disease is classified as the sixth leading cause of death in the United States. It is the most widespread cause of dementia among older adults. The odds of having Alzheimer's disease grow significantly after the age of 70 and could impact 50% of persons over the age of 85. If new cures aren't developed to lessen the probability of developing Alzheimer's disease, the number of people with Alzheimer's disease is predicted to affect 13.8 million by 2050. Scientists gather that for most adults, Alzheimer's disease is generated by a mixture of environmental, genetic, and lifestyle elements that influence the brain over time. While the causes of Alzheimer's disease is not completely established, its impact on the brain is obvious. It is a neurodegenerative disease, meaning there is continuous brain cell death that occurs over a period of time. As death of brain cells increase, the brain begins to shrink as well. When physicians study Alzheimer's brain tissue under an optical instrument, they can detect two categories of irregularity: plaques and tangles, that are viewed as trademarks of Alzheimer's disease. Memory complications are normally one of the first indications of cognitive disability associated with Alzheimer's disease. Memory loss related with Alzheimer's disease continues and intensifies, impacting your capability to take on tasks. It causes one to have trouble focusing and reasoning. Impaired visuospatial potential is substantially problematic as well. Reacting successfully to day-to-day matters such as food scorching in the oven or unanticipated outings. Brain changes that prevail in Alzheimer's disease can alter the way you behave and how you feel. Individuals with Alzheimer's may be faced with moodiness and assertiveness, mistrust of others, alterations in sleeping patterns, wandering, depression, and social elimination. Several essential abilities are not lost until late in the disease. Specific lifestyle decisions like physical activity and diet could aid brain health and hinder Alzheimer's disease. Numerous studies reveal that preserving social relationships and remaining mentally active as we begin to age could perhaps decrease the risk of Alzheimer's. Several lifestyle adjustments have revealed to decrease the chance of heart disease and diabetes, which have been linked to Alzheimer's disease. And right here I have this is what the brain looks like. A healthy brain compared to a brain with advanced Alzheimer's. And the symptoms, which include memory complications, memory loss, trouble focusing, impaired vision, moodiness, mistrust of others, wandering, depression, social elimination, interrupted sleep patterns. And there's a few preventative measures you can take to prevent Alzheimer's, which would include eating a healthy diet, staying physically active, mentally active, as well as socially active. And this is an image of what a normal brain looks like compared to mild cognitive impairment, and the last one would be a brain with Alzheimer's disease. And on the right I have some facts about Alzheimer's disease. A German doctor named Alois Alzheimer first observed Alzheimer's disease in 1906. He defined a patient known as August D. who experienced memory loss and other problems thinking. The possibility of having Alzheimer's disease increased after age 70. If new cures aren't developed, the number of people with Alzheimer's disease is predicted to affect 13.8 million by 2050. Over 15 million Americans are unpaid caregivers for someone with Alzheimer's disease or another form of dementia. More women than men have Alzheimer's disease, and a person with Alzheimer's could lose their sense of smell as well.